Hello, everybody. Thank you for joining us. Welcome to this great Q&A FAQ conversation with Dr. Caldwell Esselstyn Jr. And brought to you by the Esselstyn Foundation. We have a number of amazing questions that people have already started putting into the chat box, so thank you so much. We also have a number of questions that people have Dr. Esselstyn gets all the time that I thought we would Jane, please don't close that, that we would go over just some basic ones, like the first 5 or so that get asked all the time so that Dr. Esselstyn can answer those for you. So I'm going to go ahead and start off. Hello. Well, first of all, hello, everybody. I'm going to start off with, what do you eat in a day, Dr. Esselstyn?
Well, if we want to, shall I keep it short because we got a lot of questions?
Yeah, we got a lot of questions. So,
cereal, sandwiches, and chili.
So
cereal in the breakfast, sandwiches at lunch, chili at supper.
So tell us about that quickly. Like, okay, so what kind of cereal? Just give us the basics.
Old-fashioned oat cereal with raisins, with bananas, with oat milk, and I like raspberries, blueberries, strawberries, and blackberries.
Excellent. Okay, so for lunch, sandwiches. So what's in the sandwich?
The sandwich is going to probably have some hummus and some arugula and some other green.
Hummus, arugula, greens. And that's on a whole grain. That's a whole grain bread, right?
Absolutely.
Yeah. All right. And then dinner?
Yeah, dinner, depending on some evenings, we have a portobello mushroom with hummus.
Yeah.
And with some greens. And it's usually on a wonderful hamburger bun, but it's not white flour.
Yeah. All right.
All right.
And you're a big beans and rice fan too. I know that.
Yeah, that's for supper.
Yeah, absolutely. All right. Alcohol. We get a lot of questions about alcohol. Is alcohol okay?
Alcohol is a toxin, and there's more recent studies have clearly shown that when you metabolize alcohol, it goes to an aldehyde, and that's not a wonderful thing for your cells. So alcohol is toxic to your brain, it's toxic to your liver, it's toxic to your kidneys, and I think that probably it's not at all unreasonable, since I'm such a liberal guy, that if you want to have a glass of wine or a glass of beer on a Saturday night or a Friday night, that's okay.
It's probably okay.
That's probably okay.
How about hard liquor? Do you ever get questions specifically about?
They're the same.
It's about the same.
Same thing. Right.
So if you want to have a drink, have one on a Friday or Saturday.
Right.
But that's probably about it. Any more than that, you're probably not doing yourself any favors, right?
Yeah. Just remember, it's a toxin.
It's a toxin. Yeah. There's a report recently, actually, that just came out.
New York Times.
New York Times was talking about how there really is no safe level, right?
That's right.
Yeah. All right, caffeine then, since we're on the devices.
Yeah. Where I have been criticized is I'm a little bit tough on coffee with caffeine. And let me tell you why I prefer my patients to have coffee that is decaf. Wonderful Greek study, then there's an Italian study, and I'll share with you the Italian study. These young subjects were divided into 2 groups. One group was drinking coffee with caffeine, the other was drinking decaf. After they drank it, they had the brachial artery tourniquet test, which determines the ability of your artery to make nitric oxide and dilate the artery. Well, after they drank the beverage the first time, they switched groups. So the group that was previously having coffee that was decaf was now having caffeinated. It was always the group that was having coffee with caffeine that injures the endothelial production of nitric oxide. Because that's what we want. We want nitric oxide.
And people always follow up usually with the question about, what about tea?
Yeah, the data don't seem to be quite as harsh. It's something about the mixture of the coffee with caffeine, because I don't see the same problem with black tea or green tea, which has caffeine.
Especially green tea. Green tea seems to have a lot of
reason to go easy on the caffeine is that people who have a tendency to have cardiac arrhythmias, especially atrial fibrillation, things like alcohol and caffeine we want to avoid.
Yeah. Green tea supposedly has a lot of good antioxidants in it as well. It's pretty low caffeine also. Yeah. All right. A question that often comes up is, what tests should people take to check the progress. If they've gone plant-based, they want to know if they still have calcium, if they still have buildup. Is there some test that you would suggest people take every year, every few years?
Yeah. Now, the easiest one are the persons who come in with chest discomfort or angina, because they can often be the most dramatic, because as you get these patients to convert to whole food plant-based nutrition, immediately their level of nitric oxide, the great vasodilator, goes up. And as soon as that happens, these patients get more blood to their heart muscle.
Mm-hmm.
And when they get more blood to their heart muscle, then away goes their chest pressure, their chest discomfort, their angina. So they really suddenly know often, within 4, 6, 8, or 10 days of starting the program, they can see this improvement.
Mm.
And boy, you've got them hooked. They absolutely know that what they're doing is working on the right side. Now, what about those that don't have chest pain or angina, but still have significant disease? And they're going to look at other things. You can, to me, the safest thing of all, without radiation and without any contrast, that is anything being injected that is a contrast that might injure the kidney, is a stress echo stress test. For instance, if you have the stress echo stress test at baseline when you start, then repeat it in 11 to 12 months. It'll either be markedly improved or back to normal.
So stress echo test is probably the best one.
That seems to be.
How about calcium tests or calcium scores?
Now, that's kind of an interesting question, because calcium score, just so everybody knows what it is, you get a CT of your chest, and there, if you do have coronary artery disease that is calcified, you will see it in the left anterior descending artery, the circumflex, or the right coronary artery. And you can identify the patient does have coronary disease. That's because the calcification is in it. Now, but there is a caveat to this. And I first learned about calcium score perhaps most 15 or 8, no, maybe 20 years ago, in a conversation with William Castelli. And Bill Castelli was, for 30 years, the director of the world famous Framingham Heart Study outside of Boston. And Castelli said, when a physician orders a calcium score, you get two pieces. It tells you two pieces of information. One, we just mentioned, it tells you that the patient does have calcification and they have coronary disease. He said, but it tells you, but it doesn't show you that patient, often when you first see them, also will have some non-calcified inflamed plaque, all right, which is somewhat more dangerous because the plaque can rupture and cause a heart attack. But he said, let's do this. Let's take the patient who has a calcium score of 440. And over the next year, they absolutely get it right. And they're completely committed to whole food, plant-based nutrition, which is so anti-inflammatory that during that year, during that year, they, as I said, they've eaten the whole food, plant-based nutrition. And then at the end of the year, they repeat the calcium score, and it's no longer 440, it's 550. And Castelli said the patient, though, is much healthier. And here's why. During that year that the patient is consuming whole food, plant-based nutrition, the inflammation in those previously non-calcified inflamed plaque, the dangerous ones, is going down. And he said, it is as though the body would like to get in on the act, that it will deposit some calcium in those previously non-calcified inflamed plaque, which now, of course, helps to stabilize the plaque. It's not going to rupture, and you're much healthier off. But a lot of physicians don't know this. And so when patients commit to whole food, plant-based nutrition and their calcium score goes up, don't panic. You're doing the right thing.
Okay. Interesting. Fascinating.
Yeah.
Supplements.
Yeah. Now, I do think it's important for the patients to take B12. That's the one that I'm really kind of insisting on, because as we get more senior and as we lose intrinsic factor in the lining of our stomach and our gastric acid goes down, both of those which are important for helping to absorb B12, probably when over 70, I like people to take probably close to 1,000 micrograms of B12 daily. And it's not like you're going to be overdosing, but you're going to want to be sure that your B12 is safely covered. Now, then the whole question comes up about what to do with D and omega-3.
Yep. That's
And-
one of the questions actually that came up. Someone was
Yeah.
asking about omega-3s.
And omega-3, you can always get a test. First of all, let's say that you want to try to keep your omega-3 at a safe level. You want to have maybe a tablespoon or two of flaxseed meal or some chia seeds on your cereal in the morning, as well as plenty of green leafy vegetables, and that should really cover you rather nicely. If it doesn't, you can know this by getting a blood test, which will show that you're optimal, borderline, or low. And if you're low and you want to put it up, mention the few things that I just discussed, or you can take omega-3 algae till you kick it up into what is an acceptable or normal range. D, you probably are going to get, let's put it this way. If you get some sunlight,
Yeah.
that is the safest and regular way. 15 minutes a day to keep your D levels up. You can always have your doctor check your D level and see some places if it's the borderline is 30. If you're considerably under 30, you might want to take a modest dose of 1 or 2,000 international units. I'm not a great fan of any of those mega doses of D. There is some suggestion that could be dangerous. And it's interesting when you think about the entire field. I mean, every now and then I'll have a patient come to our seminar who, when I talk to them beforehand and take their story, there's this enormous list of supplements that I never would dream of giving a patient. And I just have sort of collected a couple of, I'll say symposium for lack of a term here. And yeah, it's a group of expert physicians who I consider experts in this area. And the bottom line is, I mean, the supplement industry right now is really a racket.
Yeah.
It is. You have no idea that what you're taking is really what the bottle says it is, and you may be harming yourself. And rather than the supplements that we've just discussed, their suggestion really is you should really try to get almost all of your vitamins and nutrients from a variety of healthy foods.
Healthy foods. Exactly. All right. The no oil thing. This is a question that we get all the time. I recently got a question through email about the fact that possibly some reports had come out recently that were saying that olive oil specifically might be good for you and protect you in some way. There's some special piece to it, but I know you're staunchly against oil. Maybe if you could touch on that for a moment.
Yeah. What are the great food products in oil that are so healthy for you? It's all 110 calories per tablespoon. That's just fat. We'll start with that. 17% of olive oil is saturated fat. All right. And now the other thing is that I wrote an editorial for the International Journal of Disease Reversal and Prevention that was published in 2019. And the title of my editorial was, "Is Oil Healthy?" And in that editorial, I list the studies with animals, I list the studies with humans that shows how olive oil will injure the endothelial lining. Remember, the whole thing you're trying to do to protect yourself from cardiovascular disease, you want to have all the nitric oxide you can. And the nitric oxide is being produced by your endothelial cells that line the artery. So I don't like anything that's going to injure the endothelial cell. And so I think the data are pretty clear. Also, I have yet to see a study of patients who are seriously ill with cardiovascular disease. We're going on a diet of oil as a regular part of it, that they've ever arrested or reversed the disease.
Yeah. And I think it's, in my opinion, It's sort of like the red wine argument. You know, a lot of times people say, "Oh, there's stuff in red wine that's so good for you, so you should be able to drink red wine." But we know that if you just eat grapes, you can get the same resveratrol. I think it's the same with olive oil. There's other things you can eat to get the benefits of whatever might be in an olive, not wrapped in all that saturated fat, right?
That's right. That's
yeah.
Right. I remember Neil Barnard saying once, he said, "I never saw an olive oil bottle growing on a tree."
Yeah.
Yeah, I don't have a problem with the olive.
How do you feel about fasting?
I think I'd like to remain open on that. I think there's a lot to still be learned about fasting, and I'm afraid if it goes out superficially, there could be people who do it perhaps incorrectly.
Yeah.
And that's my only reservation. Otherwise, I think there probably are going to be some situations where, in skilled hands, that fasting can be done safely, and it can achieve the goals of usually is weight loss. And so I think with that, thank you,
Yes.
sweetheart. I think that's my thought on fasting. And I know that my good friend Alan Goldhammer, who runs True North as a fasting center, is one of those who has quite a skill set and experience with fasting, and they can do it safely there.
Yeah, especially for people who are trying to lose weight. I know you've spoken to a number of people who come to you and say they kind of plateaued in their weight loss. They went plant-based and they sort of hit this plateau. And a lot of times that's a great way to break through that plateau, right? To do some intermittent fasting.
Yeah, that, or also take a careful history and see what they define as their moderation.
Yes. Making sure they're truly plant-based.
Oh my goodness. Yeah. You suddenly, it's like saying, one of the questions I always ask people is, how often do you eat out? And the first reply I almost always get is, "Oh, not very often." And I said, "Well, would you mind going over that again?"
Yeah.
Well, maybe once or twice, maybe 3 times a week.
Yeah.
All right. So if it's somebody who's already had a heart attack, and they go to a restaurant, because you're going to get oil unless you can have a special relationship with the chef, which you can do.
Yeah.
But if you go to a restaurant, all the menus have oil. So if you're going 3 times, all right, a week, that's not 100. Let's say that's about 106 days out of 365 that you're further destroying.
Essentially a third of the year. Yeah.
That's exactly right. You're destroying further the endothelial tissue, which is so vital for making nitric oxide, which was responsible for the first heart attack that patient who's inquiring had. Yeah.
All right. Someone has a question about natural sugars making triglycerides go up. Do you know anything about that?
Well, on sugars, let's say a natural sugar would take an orange or an apple. All right. Squeeze it. What do you got? You got juice. What's the juice? It's glucose or fructose. And that's a natural sugar that is going to injure your endothelial cells. You can have an apple. You can have an orange. Why do I say that? Because with all the fiber in that fruit, the absorption is safe and slow. Okay. So in that situation, I have no problem with people eating an orange, eating an apple, but when they make it into juice, now I got a problem.
Right. Because
it's so rapid. It's like a rocket going off in your stomach.
Right.
And that's going to injure the endothelial cell.
All right. So I know that you are not in favor of water with fluoride or toothpaste with fluoride. But
no, that's just information that I got from Nathan Bryan, who's the pioneer in this alternate method of making additional nitric oxide. We keep saying, and we know that the endothelial production of nitric oxide is age dependent. Okay. So, for example, you never heard of a boy or a girl who's 8 years old having a heart attack, right? They got nitric oxide coming out of their ears. Right. But by the time they're beautifully healthy at age 50, they now have 50% of the nitric oxide they had when they were 25. And by the time you're 80, you've lost 70%. So if nitric oxide is the key that we want, it's so exciting that on the scene about 15, 18 years ago, when Nathan Bryan define how we can get this from green leafy vegetables. Do we have time that I should go over that?
Absolutely.
Or, because, all right, so you want nitric oxide, and you know that as the endothelial production of nitric oxide is age dependent. So as you get to be older, you're not going to make as much. What Nathan Bryan showed, that when you take and eat a green leafy vegetable, and actually it's about, say, half the size of your fist, and then after it has been steamed 5.5 to 6 minutes, you then anoint it with either several drops of a delightful balsamic or rice vinegar. Why? Because research has shown us that those vinegars, the acetic acid of those vinegars, can restore the nitric oxide synthase enzyme that is responsible for making nitric oxide. It's inside the endothelial cell. So in that situation, you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich. That's 3, mid-afternoon 4, dinner time 5, and of course I adore it when you have that evening snack of arugula or kale. Now, the second benefit from chewing the green leafy vegetable is it restores the capacity of your bone marrow to once again make the endothelial progenitor cell, which will replace our senescent, injured, worn out endothelial cells. Now, the third benefit from chewing the green leafy vegetable, when you do that, you're chewing a green nitrate. As you chew the green nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce the nitrate that you're chewing to a nitrite. Once you swallow the nitrite, it is now your own gastric acid, which is going to reduce the nitrite to more nitric oxide. Think about it. With minimal expense, no hideous side effects, from dawn to dusk, all day long, you are absolutely restoring nitric oxide, the very molecule, the deficiency of which gave you this disease in the first place. Now, there is a caveat here. Toothpaste with fluoride, public drinking water with fluoride, and mouthwash will injure the beneficial bacteria in your mouth. And I do not like antacids. Why? Because antacids will reduce your gastric acidity, and you will be unable to reduce the nitrite to more nitric oxide. Now, the top 6 greens would be kale, Swiss chard, spinach, arugula, beet greens, and beets. We can give them the whole list later on.
All right. What do you think of these speaking of nitric oxide, what do you think of these nitric oxide strips? Do you think they're reliable?
Now, that's an interesting thing. It kind of, for some people, can be helpful, because if you send away on your computer when it says nitric oxide test strips, and you get a little plastic vial where these test strips, and if you put a drop of saliva on the test strip, it'll either be mildly pink, or it could be even moderately pink, or it may be dark pink, in which case that's plenty of nitric oxide. So it's a kind of a way of getting some feedback as to whether you're doing this whole green leafy thing for nitric oxide correctly. Now,
you did an experiment, didn't you? Didn't you eat a bunch of greens and then do it, and then it changed? It got better.
Oh, absolutely. Yeah, sure. It absolutely is reflective of how you're doing.
Wow. All right. You say no nuts, but what about these nut-based milks?
Yeah, I don't have a problem with them.
Yeah, because it's just
almond. The almond milk, oat milk. Yeah.
Yeah, you got to read the labels, of course, because a lot of times those things, some of them will have
some of them
have some oil in it. That just make sure you read the ingredients.
No oil.
But yeah, so that's a question. I think that's a really interesting one, which is, I guess it's just not enough concentrated nuts that it's going to give you a problem at all, right? How about this? Can foods high in oxalates cause kidney stones?
Yeah, that's a good question. And I think there may be occasionally a patient who has a sensitivity to oxalates and will occasionally, or has been making oxalate stones. But as a rule, we just haven't seemed to see that. We've, let's see, in the last, I think since 2009, and some 1,500 patients that I've treated, I have yet to have a call from a patient. But I'm not asking them to eat spinach. I mean, if you go to if you go to the internet and you look up the green leafy vegetables in terms of oxalate, you can find the ones that are low in oxalate, but you don't have to have spinach, which is very high.
Yeah.
Remember, I told you that there are 6: kale, Swiss chard, spinach, arugula, beet greens, and beets.
Right. Those are the powerhouses.
Yeah.
What would cause liver enzymes to go up on a whole food plant-based diet?
I wonder if the patient is also taking a statin.
Because that will drive up liver enzymes?
And some, not in everybody, but there are some. See, the statins have got some side effects. Statins can cause severe muscle cramps. Statins can cause liver injury. Statins can cause diabetes. Statins can cause brain fog. Okay. But I don't want those patients to panic about that, because we found that in our seminar, many patients, long before they ever heard of us, simply couldn't take a statin because of the side effects. And they do just as well as the patients who take statins, providing they're following the program as indicated.
So that's that'd be an interesting follow-up question for that person. Any recommendations on mild mitral valve regurgitation?
Keep an eye on it, and if it's not significant and it's not in any way impairing your heart activity, I would simply follow and keep an eye on it.
Okay.
I wouldn't have it operated unless it's significant. No.
All right. Will oats reverse heart disease?
Well, I think what I'd like to, certainly oats is great for helping to lower your cholesterol and other wonderful nutrients. What lowers heart disease actually is when you stop injury to the endothelial cell, because what causes heart disease is when you've injured sufficient endothelial cell production of nitric oxide. Now you're short on nitric oxide, which has got these wonderful functions that protect and preserve the integrity of your endothelium. So that I would simply say that we want to avoid anything that wants to injure the endothelium. Give me the rest of that question.
It just says, will oats reverse heart disease or just stop it?
Oats itself is not going to stop heart disease, but it's one of a package of wonderful foods that's not going to further injure, and will go along towards restoring the endothelial health and the ability to make nitric oxide. So I guess you could sort of squirm that into
right. Yes, but not single-handedly.
Right.
All right. Is it okay to eat 6 servings of greens if you're on Coumadin?
Good. That's an excellent question, and that came up frequently now, going back years. And of course, if you have a lazy physician, and they don't want to mess with your Coumadin level because you've got to have a certain level of anticoagulation, and they achieve that with a certain dose. I think what I always told the patients when doctors say don't eat it because there's too much vitamin K, it's going to mess up your clotting.
Right.
No, tell the physician, look, here is my diet. I am consistently going to be eating this amount of greens, and they will appropriately adjust the dose of Coumadin so that you can still achieve the recommended level of anticoagulation.
Yeah, because those 6 greens a day are going to be so powerful for your overall health.
Yep.
You should get them to adjust the Coumadin.
Yep.
All right, John, do you have some more questions for us? We're cranking through them here.
Am I talking too fast?
No, this is great. Will this lifestyle help with Hashimoto's?
Yeah, it's good. I'd like to see the study on that. Hashimoto's thyroiditis. Yeah, that's just sort of inflammation of the thyroid. But I just haven't yet seen a solid study where you took a group of patients who had Hashimoto's and you gave them whole food plant-based nutrition, and it resolved what. In the years when I was doing thyroid surgery, and I would see a fair number of thyroid patients, anybody with Hashimoto's thyroiditis on needle biopsy, we would certainly protect them from having from having any surgery, and usually would give them either levothyroxine or Synthroid, that is, so they have an adequate amount of thyroid hormone so that the body isn't pushing this gland, which has some inflammation, and it keeps it from growing.
But a whole food plant-based diet is probably not gonna.
Well, no, I'm gonna hold back on that. I'm gonna say I'd like to see the study, because there's been a few isolated instances where people have claimed that, but I've not seen the one that's large enough or repeated. Yeah.
Okay.
But you're gonna go fine. If you got Hashimoto's thyroiditis, you're gonna do fine.
Yeah. Yeah. All right. Let's see. So you're going to get it up from omega-3s on this. Would a juice fast help boost immune system after chemo for breast cancer? Are you a fan of like juice fasting, especially if someone's post chemo?
Again, to answer something like that, what seems to be protective against some of these cancers is that if you are eating whole food plant-based nutrition from, let's say, almost from day one, when you start eating solid food. Because if you look at, when I reviewed a number of years ago, actually it was for the movie Forks Over Knives, there are a number of cultures on the planet that their rate of breast cancer is 30 and 40 times less frequent than the United States. Now, that isn't to say once that somebody has an established cancer in that country that it's that the overall incidence of cancer developing is less. But what happens, for instance, to the Japanese women in rural Japan after World War II? And when those Japanese women would migrate to the United States, by the second and third generation, they now had the same rate of breast cancer as their Caucasian counterparts. So I don't think there's anything at all against going whole food plant-based nutrition as a woman as early as you can to protect yourself. But it would be totally unfair of me to say that once you've developed the cancer that you're going to halt and reverse it. But it still gnaws at me that is something that I would always wanted my patients with breast cancer to convert to whole food plant-based nutrition.
What about baby aspirin per day? A lot of doctors recommend baby aspirin.
My answer to that is baby aspirin is a drug.
Yeah.
Right? And, when you think about it, why is it being offered to so many people? Are they offering aspirin to those cultures where cardiovascular disease is virtually non-existent? For instance, do the Okinawans live on aspirin? Papua Highlanders in New Guinea, rural China, Central Africa, are they all on aspirin? No. Do they have heart disease? No. And often side effects of aspirin are not discussed. For example, especially in the senior patients who take aspirin, they can have a gastrointestinal hemorrhage, they can have a cerebral hemorrhage, and in addition, that often not discussed is macular degeneration in a small percentage, blindness. And I think, therefore, to take a drug with that kind of side effects, I would much prefer that the physician who is ordering their patient to take aspirin ask the patient and take the time to instruct them about whole food plant-based nutrition. Because you see, it's not only embarrassing for this country, but it's shameful to think that we have known for 100 years that there are all these cultures that I've already mentioned tonight where cardiovascular disease is virtually non-existent until they've adopted our diet, because it used to be they'd get sick when they came to this country. Now we've exported our diet so they can get their coronary disease at home.
Right.
But so why is it that right now, and this is with all due respect to my cardiovascular colleagues, none of the drugs they use for coronary disease, none of the stents, none of the bypass surgery has one single solitary thing whatsoever to do with the causation of the illness. When we looked at our results that we published in 2014, some 198 patients followed close to 4 years. The adherence rate was 90%. Actually, there was, and we looked at the patients, how they did over close to 4 years. And those that, the 21 patients out of 198 who did not comply, 62% had disease progression. The 90% who were compliant, none. Actually, if you read the paper, you'll find one that did. But the only reason there's one, my co-authors agree that we better put one in there because nobody will believe you.
Nobody will believe you.
If you say it's 100%. So it's pretty exciting that here we have the leading killer of women and men in Western civilization. We have the data, and it's been proved time and again, either by epidemiologic studies, wartime deprivation studies, or studies like Ornish and our own. And so it's really, you kind of wonder, why hasn't cardiology bought into this? And I hate to bring up a method of compensation, but what do you suppose you get paid for a bypass or a stents or all these drugs versus talking to them about Brussels sprouts and broccoli?
Right. It's amazing. There was a question a moment ago that I just scanned that mentioned the EPIC study.
You have to give me a minute. I have to think. What is the EPIC study?
Two recent EPIC Oxford study involving about 40,000 patients concluded if non-vegetarians have statins, their risk of heart disease is the same as vegetarians. Which I thought was pretty interesting.
So they have less. In other words, just a statin alone takes them down to the level of safety you see with a vegetarian.
Right.
But even vegetarians, but remember, the vegetarians are going to eat French fries. They're going to eat oil.
They're not whole food plant-based.
Glazed donuts. Yeah.
Yeah. There's a lot of ways to be a vegetarian.
Oh, yeah.
Yeah. How about amla powder? You've recently said you've started to do a little amla powder. What do you think about that?
I don't know. I think that I'd like to see more studies on it, but I think that probably a half a teaspoon or something like that might decrease triglycerides, or maybe actually help decrease hypertension.
How about beet powder? There's been some interesting studies about beet powder.
Well, they got a lot of powders out there now, and that why do you suppose there's been this avalanche of powder?
Because
to make money.
Yeah, to make money, you can buy it, right?
And it's processed. So I don't know always what's in that stuff, and rather than
why not have beets?
Have pea powder when I eat the peas,
right?
And it's the same thing with beets. So I guess I'm a little old-fashioned on that one, and I'd like to steer away from that which is so processed.
Yeah, probably better just to eat the beet.
Yeah.
How about osteoporosis and whole food plant-based nutrition?
You know, the whole business about osteoporosis, osteopenia is kind of interesting. And my preferred treatment there is to have patients recognize that the bones love stress. For instance, somebody said, I walk 2 miles a day. Walking isn't going to do it. Walking is wonderful. I'm not against walking. I think it's fine. But if they're going to be protecting your bones, there have been studies, for instance, where women go to the gym and they do lunges, or they do a deadlift, or they do squats. They've all been shown to build and strengthen bone, because when you're take a weight, maybe you have to be something you can safely handle. Let's say you've got it on a squat rack, and you do that every day. And my gracious, it's the bones really impressively respond, providing you take a weight that is heavy, but you can safely handle it. Now, you don't suppose you can't go to the gym. You're at home, or you don't like to get undressed and change and go, and you want to do this at home. Well, then I think the situation there, you can over the internet, you can purchase a weighted vest. A weighted vest.
Yep.
is the same idea. You can do with a weighted vest on, you could do lunges at home, and you could actually do some squats.
You could wear a backpack with some
Yeah.
weight in it.
Yeah, absolutely. Back if you don't want to send away for that weighted vest, yeah, you do a backpack with a couple of cans of pineapple or something in there that gives you the weight. But that's that to me seems to be a very simplistic and safe way to answer the problem. Now, obviously, along the way, you're going to get appropriate amounts of vitamin D and vitamin D and calcium, and you're not going to be deficient in calcium. There's so much calcium in green leafy vegetables. Yeah.
And so
I wouldn't.
I lost my train of thought for a second. About osteoporosis. Certainly, being on a whole food plant-based diet, you're going to prevent yourself from eating the super high protein diet, which is ultimately going to cause you to sort of pee away
your bone.
your bones.
That's such a high acid diet that
right.
Yes.
So that's a benefit too of going whole food plant-based in terms of your bones. A way to cook greens or eat them raw. What's the best way? Is it okay to eat them raw, or do you have to cook them?
You can. I kind of like them cooked because I've read some data that suggests when you cook, you soften up the cell membrane so that when you start chewing, you get much more of the intracellular phytonutrients.
So better to cook them a little bit, it sounds like, from at least some studies.
Yeah.
Thoughts on complying 6 days a week and cheating once a week? What do you think about that? I kind of know what your answer is going to be.
Well, I just about 2 weeks ago when I was counseling a couple where the husband had had a heart attack, and I got through, and the wife looked at me and said, "Well, Dr. Esselstyn, you haven't discussed what are the cheat days." I said, "Could you spell that?" Yeah, she said CHEAT. I said, "Okay." He said, "What you're saying is, if your husband is good all week long, on the weekends he could sort of break the fast, as it were." Yeah, she said, "That's what I was thinking about." I said, "Well, wait a minute. Remember, I've just discussed with you the whole reason that your husband had the heart attack was because over the years he has so sufficiently destroyed his endothelial tissue, he couldn't make enough nitric oxide to protect himself. So what you're suggesting is that 2 days out of the week, or maybe that's 104 days out of 365, that you're still destroying more endothelial cells so he can set himself up to have a second heart attack." Oh, I didn't think of it that way.
Yeah. And it's important to remember, hopefully people realize that the people that you work with often are very sick people who've had multiple stents, bypass surgery, are really in tough shape. So for them to take a cheat day is really a terrible idea. Not to say that it's not terrible to take a cheat day anyway, but for a lot of the people you work with, I know you've had some clients or some patients in the past that started to drift off and maybe try some of these Impossible Burgers or Beyond Meat, and then they ended up having some chest pain, right? So these are people that are very sick. Is peanut butter powder okay for someone with cardiovascular disease?
Well, again, it kind of falls into that category that I'm still a little hesitant on. I mean, this is something that's highly manufactured. If you don't have heart disease and you're going to have some peanuts, probably that's okay. But if you have heart disease, see, a couple of my reasons for not being rather reticent on nuts is that one, it's a lot of saturated fat.
Right.
I have yet to see a study of patients who are seriously ill with cardiovascular disease, heart disease, where being on a peanut diet, they can halt and reverse their disease.
Right.
All right. And the other thing is that often overlooked is a wonderful study by Dr. Veselinovic, published in, in a journal, I think it was Atherosclerosis, in the mid 1970s. That's going back a ways. And he took three groups of rhesus monkeys. One group got the butter fat, the other got corn oil, and the other had peanut oil. They followed them a year, and then sadly they sacrificed the animals. But the peanut oil group, the arteries are just absolutely ravaged with heart disease.
So there's something about peanut oil.
That,
yeah, but I think they're asking about peanut butter powder, which is stuff called PB2, which
Yeah.
Anne talks about sometimes,
Yeah.
and that's one that's had a lot of the fat removed. So it's certainly better than regular.
Pure.
Yeah, PB2 pure is the stuff to get if you're interested in peanut butter powders.
I'll be interested in seeing the study of PB cure that shows that you can halt and arrest heart disease. And then I'll think about it for my patients.
Yeah. All right. Fresh versus frozen versus canned veggies. Is there one that's better than the other, or fresh versus frozen versus canned?
Fresh and frozen, I think, would be tops.
Yeah, canned often is salted or packed in some things. You just got to be careful what's been packed.
Yeah,
in.
so that has been manicured.
Yeah. So fresh and frozen. We're huge fans of frozen. I mean, frozen is often flash frozen right at the point of harvest. Does whole food plant-based prevent stenosis?
By that, do you mean the aortic valve?
I'm assuming that just says, what does whole food plant-based prevent?
That's usually when we use actually the word stenosis means narrowing.
Okay.
So if we have to differentiate. If we're talking about stenosis in an artery, that's with coronary artery disease. But usually when I hear the term stenosis, they're referring to disease of the aortic valve, where those valve leaflets become progressively scarred and stiff, so that when the left ventricle contracts, it's having a difficult time pushing blood out of the heart into the aorta. And when it's relaxing, the blood that it is just pushed out, since the valve doesn't flap shut, can flow right back into the heart. So it's sort of doubling its work. Gotcha. And the best thing for that valve to do when that situation is prevailing is to have it replaced. And fortunately, in the last 15, 18 years, you don't have to have, most cases, you don't have to have this done with open heart surgery. They can do it very safely and very effectively with a catheter in your home in several days.
So whole food plant-based nutrition is probably not going to help with stenosis? No. Okay. Let's see here. John, you got any more for us?
Yep, I got two quick ones here.
Thank you. Eating plant-based, but struggling with menopausal weight gain. Any thoughts on that?
Well, let's go over when you're eating plant-based. Usually, weight gain is not the problem, because first of all, if you're eating plant-based and I take away your oil, I take away your animal protein, I take away your dairy and your sugar, that's a significant number of calories if you stick with that and do it accurately. Now, the other little wrinkle that we use is in those patients, if their weight is an issue, have them also eliminate the flour. In other words, when you take a grain and you grind it into flour, you essentially compromise and injure the nutrient value of that grain. And the flour manufacturers know this. So they will label on their product enriched. But what you're really getting is lousy nutrition and a lot of empty calories. So if I take away your oil and your animal protein and your dairy and your sugar and your flour, that is, what is flour? That's pasta, bread, rolls, and bagels. And if you're not having your first helping be the second and third, you're going to lose weight.
Yeah.
And that's, I think, a lot safer than getting into some of these other.
How about whole food, plant-based, and Alzheimer's or dementia? Any?
My good friends, the Desai,
the Shares Eyes.
the Shares Eyes feel that you can. What's the early stage? Mild cognitive impairment, which is the earlier stage of one of these Alzheimer type dementias. And if you can nail those people to go plant-based, no oil, have interactive friendships, no smoking, and have a focus.
Right. And good night's sleep.
Yeah, and absolutely have sleep. You can slow down, perhaps. I'm not sure about totally reversing, but you can certainly more favorably slow this down. I've recently just, I don't know why this happened, but I've just recently met some people who just seemed sharp as a tack, but they were diagnosed already with mild cognitive impairment, and they are really very aggressively going after whole food plant-based nutrition to see if that won't be effective. We just really are in the early stages of trying how to understand some of these dementias, and unfortunately or hopefully something around the corner will come, because we got to do a lot better with it. Because right now, at age 85, 50% of Americans have dementia, as do 50% of Swedes. So it's not unique.
How about lipoprotein A, LP small a?
Yeah, LP small a is interesting. This is another form of cholesterol. And normally people, the cardiologists, like to have it under 30, but the frustration with LP small a is it seems to be rather stubborn. You can't seem to change the value you got. And so you sort of, if you might find yourself resolving that you're going to have a problem down the line, or get very depressed about it. I've seen that on occasion. But my own feeling on LP small a, it isn't unique to the United States of America. All these other cultures have it. And what have we talked about earlier? We've talked about these other cultures who never seem to have heart disease. Right. And yet here they've got LP small a, right? Some of them are high. And when I reflect on it, that group of patients that we reported of some 100, let's say there were 198 total patients, and then there was 177 who were compliant. And those that were compliant, remember, over 4 years, we didn't have any cardiac events, no stroke, heart attack, or death in that group that were compliant. Now, there were any number there that had elevated small. So I guess what I would say to the patient with LP small, it's just another form of cholesterol. It's trying to interfere with your life. And if you are going to eat whole food, plant-based nutrition, you have built yourself an endothelial fortress. So even if you have a few extra molecules of LP small a coursing through your arteries, they're not going to find a crack, a fissure, an opening in this endothelial fortress. So you should be able to live with that.
So don't worry about it as long as you're eating whole food, plant-based.
Right.
How about beta blockers? Someone writes in and says that they're 75, their BP is 118/75, and their doctor wants them to take a beta blocker.
Yeah, I try not to, and ever in these discussions we have, which are always kind of fun, I try never to drive a wedge between the patient and their physician. And if they have a physician who feels that the level of hypertension in somebody warrants taking a beta blocker, that's fine. But at the same time that's going on, I'd look at why is there hypertension? And most often, if you really investigate it carefully, you'll find that often those patients can lose a significant amount of weight, or sometimes even a modest amount of weight, which will help to really bring under control that hypertension. And so that rather than get in a quandary with an argument with the doctor about whether to take a beta blocker, which may be appropriate until you have lost the weight or gotten control of your hypertension, rather than get in a squabble about the medicine, I try to find out what is causing the hypertension.
How about AFib? A lot of questions about AFib.
Yeah, AFib is the most common cardiac arrhythmia, and it's It's really kind of a fascinating as it seems to be increasing in frequency. And I happen to be feeling very aggressive about atrial fibrillation because while you can safely often get the control of the rate of the heart beating so you don't injure the heart, because so frequently patients with atrial fibrillation that is not controlled, if you're constantly having a heartbeat of 150 or 180 or higher, your heart tires, it wears out. So you have to bring that rate down. Now, the other thing, though, is that when you take 1,000 patients with atrial fibrillation, another 1,000 without it, there's a higher mortality in those that are taking atrial fibrillation. So I like to get rid of it. And the way to do that is to try to identify for the patient where is there, and there are multiple clinics now that have this, expertise in ablation. And ablation is simply, well, let's discuss what atrial fibrillation is. Remember the master spark plug. The master spark plug that starts the heartbeat off is the SA node identified in the upper right, in the right atrium. And you get this nice, beautifully coordinated lub-dub, lub-dub. But what happens in atrial fibrillation is, for some reason or other, the body forms these small little competitive spark plugs in the adjacent area up around the pulmonary vein. And lo and behold, if you go in with a catheter with a radio frequency tip, identify that aberrant spark plug, zap it, or you can freeze it.
Yeah.
You'll eliminate it, and you can often restore sinus rhythm. Now, it's tough because even in the best of hands, it may be about an 80 or 85% success rate with the first pass. And then there are occasions when certainly a second go around is appropriate and warranted. But my answer to atrial fibrillation is to get rid of it. You want to be sure that the person you see who does this, ask them what their track record is, what their success rate is, and don't be bashful about it.
But whole food plant-based can't really do anything about AFib. I mean,
No.
It's certainly going to help your heart health,
Yeah.
but you're just not going to correct AFib.
Right.
Carbs are, I heard carbs are bad for heart health.
Okay.
If eating whole grain carbs like Ezekiel bread, are these carbs okay?
Yes, that's okay.
Yeah, that's what I thought.
Now, the carbs that are, obviously everybody agrees, if you have white bread, if you have a lot of sugar, if you have nothing with, sugary juices, it's the simple carbohydrates that everybody agrees are problematic. But what we want you to do is eat really complex carbohydrates. There's the ones that are healthy. The complex carbohydrates, what? Wheat, legumes, red, yellow, green leafy vegetables, and potatoes. Yeah.
All right. Last question. You've done a great job, Dr. Esselstyn. How do I raise my HDL? And I would add to that question, is that even an issue?
Yeah, that's a nice, interesting question. If you're wanting to raise your HDL, sadly, that's information which really now is in the dark ages. And I don't mean to be that mean-spirited about that, because what we have discovered is interesting. When I should give you the background of this. When I first started our first program back in 1985, mostly they were men. That's just the way they were sent to me. I had nothing against women. But when the men came into the program, I noticed that within the first month or two, at that time, the low level of normal HDL cholesterol required of men was 40. That was as low as they wanted it to be. Well, within a month or two, all of my male patients suddenly had an HDL cholesterol in the mid and low 30s. But at the same time, they were losing weight. Their symptoms were disappearing. And when we carefully studied them, they were reversing their disease, all with a lower than normal level of HDL. Then the next great thing that came out was when Pfizer was going to invent the pill that was going to end heart disease. Half of it was Lipitor, and the other half was torcetrapib. Now, torcetrapib was able to take the HDL cholesterol and raise it up over 100. But the problem was when they were about to bring this out for the public, the chairman of the independent monitoring committee called the chairman of Pfizer and said, "Mr. Pfizer chairman, we have a problem, sir." "Okay, what's that?" "Well, in the control group, there have been 51 deaths. However, in the Torcetra group, there were 81 deaths. It was killing people, so it didn't come out." Now, since then, there's been an interesting study, let's see, by Dr. and his team from University of Pennsylvania. They took 2,000 patients and they drew blood. And they measured the HDL cholesterol. Some were high, some were medium, some were low. Then they did an interesting thing. They measured the capacity of each of those HDL specimens that they had drawn for its ability to do heart disease, to reverse reverse inflammation. And guess what? There was absolutely no relationship between the level of HDL cholesterol that was measured and its ability to do its job of reverse cholesterol. So here we stand today with the final interest on this, and that is there was a interesting study coming out of UCLA in 2013, February, and they looked at the ApoA1 segment of the HDL molecule. That's the protein moiety of that molecule. And they found out when you are eating a regular Western diet, you injure that vital portion of your HDL molecule, and you convert your HDL from normally an anti-inflammatory molecule trying to help you into a pro-inflammatory molecule that is now joining with your LDL to injure you. Yeah. Now, the other thing that we've found is that by now maybe you've gotten this suggestion. When you take somebody who is totally plant-based and measure their HDL before they start the program, and then after they've started the program, you'll find that the HDL is lower. And then you get this crazy idea of people wanting to try to raise their HDL. No. What we found out, when you are eating whole food plant-based nutrition, your HDL decreases. Why? Because your liver is getting the message that whatever you're eating, your inflammation index in your body is so low, there is little need and it's not appropriate to make a high HDL. So it's lower. As a matter of fact, where you really get the tip off of that. Remember, I said that 40 milligrams per deciliter was the accepted low level of men. But when Bill Connor went down to measure in the Tarahumara Indians in northern Mexico, guess what their HDL cholesterol averaged? 25. That will drive the unknowing cardiologist absolutely apoplectic.
So people shouldn't worry. When your cholesterol comes down, your HDL is going to come down.
Yeah.
All right. Well, Dr. Esselstyn, what a pleasure. Thank you so much for your ongoing expertise and for sharing it with everybody. Please feel free to join us every month for our plant-based sessions that we'll do live on YouTube. There will be a recording of this that will be on YouTube that is the same address as it was for getting to the live link, and it will be up forever. So if you want to share this with other people, please do. And don't forget to subscribe to our YouTube channel, the Esselstyn Foundation. That would be really helpful, and we'll continue to do these sessions. Thanks, everybody. Have a great night.